So health. This is probably the biggest reason we are so sick as a nation is because we really don't understand at a fundamental level, we don't even really understand what true health really is. Well, first of all, what's more valuable than your health? There's nothing, right? And I know in my life, there's only two things more valuable than my health. That would be my family's health and then my faith. That's the only two things, but literally my health is my most important asset because I literally know that if I lose my health, I will lose my job. I will lose my ability to earn an income. If you lose your health, you won't get to enjoy your hobbies. You could forget golf. You can forget going to church and serving and volunteering. If you lose your health, you don't get to do any of those things we love and enjoy in life. So your health is your most valuable asset. So whose responsibility is your health? It's you. It's me. Mine is mine. Yours is yours. It's not your doctor or your spouse. Your health is absolutely your responsibility. So then who needs to be the expert when it comes to your health? Yeah, we have to be. That's the only way we have. That's the only chance we have. And that's why this system works as well as it does, because it empowers you to be the expert in your own health. And then the last question I would ask is, what do you think most people think health is? Because most people in America think health is looking and feeling what? Yeah, if you look great and you feel great, you're healthy, and if you look and you feel bad, then you're sick, right? And there is some truth to that because healthy people look good and sick people don't always look so good, but how does cancer feel? How do most women with breast cancer generally look and feel? They feel fine. Most of them feel great, or heart disease. How do most people find out they have heart disease? By having a heart attack. And that's true for 80% of people. The way that they find out that they have heart disease is by having a heart attack. And the sad thing is that half of people that have their first heart attack will end up dying from that heart attack. So they don't even ever get symptoms. And the same thing with Alzheimer's and dementia or diabetes or digestive. You don't feel those issues until they're too far gone, until it's too late, essentially. So health is not about how you look and feel. There's much more to that. And I always get the question, and it's always around the first of the year, what should I do to get healthy? What's the most important thing I can do in order to get healthy? And the best way to know that, or the best way to answer that, is to ask your body what it can go the most without. Because we all think like food, water, and air are very important. So some people think it's nutrition. Like your nutrition is extremely important. You got to have the right foods in your body. But we can live at least a month without eating food. If you ever watch Survivor, most of those people don't eat for close to a month. So food's not the most important thing. Water would probably be second because we can only go a few days without drinking water. But we know that that's not the most important thing because we can go only several minutes without breathing air. So those three things aren't the most important thing. It's nerve supply. It's the ability of your brain to literally control, run, and regulate your body. And the reason I know that is because if we took a sword and we were to cut through your spinal cord, what happens immediately? You're immediately dead. 100% of the time or 50% of the time. 100% of the time, if you cut your spinal cord and your nervous system's no longer able to run your body, you're dead immediately. You can't even go one split second without that system. So that's how our body works, is every time our heart beats, every time we digest food, the messages that come from your brain have to travel down through your spinal cord and then out over your nerves to tell every organ, cell, and tissue how to work. Even your immune system is controlled by your brain and spinal cord. So every time there's a cut on your leg or you stump your toe, if the immune system's involved, it has to tell, your nervous system has to tell that cut where to heal and how the nervous system gets there. So everything's controlled by that system. So you guys remember this guy, right? Everybody's heard his story. Christopher Reeve fell off the horse. He landed basically face first in the dirt, and the reason he was injured is because the top bone in his neck shoved into the top of his spinal cord. It was only about a 1 centimeter bruise on the top of the spinal cord, but you all know what kind of damage it did to him. And it's not just his movement, because he's paralyzed, of course, but everything else shut down as well. The tube that's coming out of his throat, that's to keep his lungs breathing. He had to have a respirator. You can't see the pacemaker that's underneath his shirt to keep his heart beating. They literally had to push on his stomach to make his bowels move. His immune system shut down, and then his hair fell out, and he died in about 9 years. Now, what's the most important thing to his body? Would you think nutrition might get him back to health? If we got him a nutritionist, put him on the advanced plan with no sugar, and gave him a perfect diet for 10 years, or maybe we get him the right supplements or fish oils, or maybe we get him a trainer and have him working out 3 or 4 days a week, or maybe we detoxify him. So we know that none of those things are important unless your nervous system's working optimally. And really, too, when your nervous system's working the way it is, that's when diet and nutrition become important. when exercise becomes important, when you know the nervous system can control and regulate your body. Now, the quickest way I know of to damage your health is instead of cutting the nerves to your spinal cord or taking a sword and chopping your head off, the next quickest way would be to shift the bones of your spine out of their normal position or alignment, and then we choke or damage the spinal cord. So we basically put choking pressure on the nerves that are controlling and regulating your body. And it only takes about the weight of a dime, or a quarter is the most recent research. If you ever held a quarter in your hand, the weight of a quarter on one of those nerves causes about 60% loss of function. So you really don't have to pinch or cut the nerve. You can almost just lightly touch it. And those nerves go everywhere. The ones from your neck go to your neck and head and sinuses and your heart. The ones in your middle back go to your lungs and stomach, and then down in the lower back, your digestive and reproductive organs. So the only way that system works is if the brain can run the body with no interference. Now this is the side view of the neck. So we're looking at this guy this way. His face is this way, his head's back that way. So you should have a nice C-shaped curve in your neck. Everybody hold your hand like the letter C. That mushy part of your hand is your spinal cord. So when you've got the right curve, it's loose. There's no pressure, no tension. When you lose your spinal cord or your curve, it starts stretching and damaging the spinal cord. And most of the people I take x-rays of have lost at least a great portion of that spinal cord. So when you're stretching your spinal cord, do you think you're getting 100% life from the brain to the body or less than? Less than, right? And it doesn't really matter if you're eating organic food. If I'm damaging your nervous system, nothing else really matters. So you got to get that in line first. This is a little video of what happens when you have subluxation in the spine, which is the condition that we treat. When you have that there, and over time, what that does to your spine and your physiology. The first thing that happens is you begin to lose the proper curve in the neck. And then over time, the bones start to deteriorate, or the discs deteriorate, and the bones start growing together. And as your discs collapse, you'll notice that the bones essentially start fusing on top of one another. Now, most people don't get a lot of neck pain until we get to right about there. That's about the most average place that people show up with chronic pain in their neck, and by that time, a lot of times, it's literally too late. So the cord, the spinal cord, again, is that mushy part that's inside of the cadaver bone. So with the curve, it's nice and loose, and that's what happens to a pathological cord if you stretch the spinal cord. Now, the beautiful thing is, who's been to a chiropractor that's not my patient before, or has not been my patient? A lot of people. Did they take x-rays on your first visit? Did they re-x-ray you 8 to 10 weeks later to see if they corrected your curve and they fixed the problem? 97% of the time, that answer is no. Because most chiropractors, and this is sad because we're not taught how to correct a spine in chiropractic school. We're taught how to get paid by an insurance company and help people get out of pain. So in our office, we do what's called corrective care. So we'll do pre and then post x-rays to see that we're actually reversing the spinal problem and actually correcting what's going on underneath. This is Mike. Mike came in, it's been close to a year now, I think, that Mike was in. He was 58 years old, and he was diagnosed with rheumatoid arthritis. And what's going on with Mike, you see how he's lost the curve? This number here at the top, that should be 31. So he'd lost about half of that angle, and then the curvature of the neck should be 43. So he's lost about 3/4 of that curve. And then at the bottom, you can see where the bones are basically squeezing on one another, and those nerves go to the heart, they go to the lungs. And at 59 years old, I got to write this down, he weighed 250 pounds, so he's basically at 250 at that point, and he was diagnosed with rheumatoid arthritis. And if you guys know, that's not a condition that they say, take a couple of supplements and you'll be fine. It's a chronic degenerative lifetime disease, essentially. So after about a month of care, the first thing we had to do with Mike, before we even talked about his nutrition or getting him burst training or exercising, we had to get his brain communicating with his body. That's the first and most important thing we did. And then over a process of about 8 weeks, we were able to get about double the angle of his C1, so not close to normal, but we're getting there. And then we doubled the curvature in his neck. So after about 12 weeks, he's basically, not only is he feeling better, but he's completely off the The methotrexate that he was on every single day, he was having Enbrel injections about twice, or two or three times a week. Anybody know what Enbrel does to the body? It literally destroys the immune system, so then you have concurrent or concomitant infections, increased risk of tuberculosis and bacterial infections. And he was on Cymbalta was going to be the next step, because when you lose your health and you feel horrible, what drug do they typically give you for that? And those antidepressants. So you could see the path that he was heading down. Had he not changed anything, then he was headed for basically what most people are in this world, and that's not a good outcome. So with the right type of care and also the right type of dietary changes, he's lost over 40 pounds, and he's no longer diagnosed as having RA. He's basically reversed his rheumatoid arthritis. And it's not because of any magic that I have in mind. It's not what I did. We just showed him the right program, and we did what the body works. If you give your body what it needs to be healthy, your body gets healthier, and it's a very simple process. So, anyone been a patient of mine over 5 years? A few, yep. So this is good news for you. This was a study done of 311 chiropractic patients, and these were seniors, so they're over the age of 65, and they compared the chiropractic patients to just average seniors that weren't getting chiropractic care, just basically other people in their demographic. So the chiropractic patients only spent 31% of the national average on health care. So according to Fidelity Investments, you're going to need about $260,000 liquid if you're going to retire today just for your health problems. So could you imagine only spending 30% of that number? Who would like over $100,000 in their pocket, right? And then 52% less medical visits. Obviously, their health habits were better. They had less cigarette consumption, and then they had about a 98% satisfaction rate with their care. The wellness patients had 60% fewer hospital admissions, about 50% less days hospitalized, and they had 60% less surgeries. And the biggie is they had 86% less pharmaceutical costs. So basically, 14% of the national average on drugs. And that's just getting adjusted. So the way we put the drug companies out of business, because we know that how evil they are and they want us all on their drugs, the best way we do that is to get everybody adjusted. That's really the simplest way to do it. And this was just regular chiropractic care. This wasn't the corrective care with the home rehab and all the physical therapy you guys are doing with it. And it wasn't the advanced plan with the burst training and all the toxins. It wasn't doing the 5 essentials. It was just doing chiropractic care. So some of the warning signs, and a lot of people carry these things around, the nerves that come out of the top portion of your neck go into your head. So if I'm damaging the nerves or damaging the nerves that go into your head, what might you likely have? So people get headaches or neck pain. Menstrual problems are the nerves in the lower part of the back, mostly in females. Those nerves go to your back but also control your reproductive organs. And then high blood pressure, the nerves that come out of the lower part of your neck are the ones that regulate blood pressure. That and the ones at the top of your neck. So that's where we always check. Anyone that has high blood pressure, we check the nerves at the bottom of the neck and also at the top. There was a study done in WebMD. You can Google WebMD and put in chiropractic study. They did a comparison study of chiropractic patients that got adjustments to their neck versus ones that were on 2 blood pressure medications combined, and the ones that were getting the adjustments had almost twice the benefit. They had no longer had high blood pressure, and the results lasted almost twice as long. So depression, insomnia, we see a tremendous amount of people with these 2 issues, and that usually comes at least portion of it's from the top portion of the neck, sciatica and lower back pain. So you see, these are all just symptoms. They're not really the problem. It's just your body's way of telling you things are not working right. So when you come in, we're not really treating any of those conditions. We're trying to get your body healthy, get your nervous system working, and get you the right dietary plan so that we can get your body healing itself. So for the guests that are in the room, those of you guys that are guests, you have this little card in your packet. Everybody take out this card out of your packet. It's this actual big card, not little. But it's about a half a sheet of paper card. And this has your Schedule Your 5 Essentials exam. So for those of you guys that are guests, this is our gift to you. This is a consultation with exam. We also do a thermal imaging study. There's technology that was done by NASA where they can actually measure the amount of nerve pressure and nerve interference, and then also the x-rays. That's about $240 worth of testing. If you sign up for the appointment today, we'll do that at no charge. So your cost of your admission basically pays for this exam. And what you do on this sheet, if everybody's got that sheet, on the top parts, you put your name and your date of birth, the best number to contact you, and then the best time that we would call. And then on there, you circle the time to the left in that gray area. You circle the time that's best for you. So you circle the time that you want, and then that would get you that appointment. And then also, too, hopefully, If you have family or kids at home, it would probably make sense that we would want to get their spine and nervous system checked as well. So below there, you can put who else you're bringing with you. So it's your spouse, mom or dad, kids. Put those people down with you, and we'll get them that same appointment. The two things I would ask on this, the two catches to this are, number one, don't make an appointment unless you plan on coming. So you might be taking someone else's slot. So unless you're serious about coming, don't sign up for appointments. But if you're there, we promise you we'll give you the same care we give all the other patients, and then help you get as healthy as we could possibly get you. Lori, where's Lori at? There's Lori. Lori's been a patient, how long, for 4 years, 5 years?
About 3.
About 3. Her and her 2 awesome boys and her husband come in as well. She's got a neat little story to tell, so I was going to let her. She does better than me, so.
Okay, I'll keep this shorter than in the
Go
past.
right ahead.
A few years ago, I had a gallbladder that just quit functioning. I live an otherwise healthy lifestyle and healthy person, but every GI symptom you can possibly imagine, I started having, and I ended up in the ER. And they did CAT scan, ultrasounds. I ended up a week later having a HIDA scan, and basically it just showed that there were no stones, there was no sludge, but my gallbladder just quit working. It quit contracting. It's a little muscle sac that stores bile, and then when you eat a meal, it would contract and eject the bile for you to digest food, and mine just wasn't working. So I went to several doctors. The pathology report came back. It said non-functioning gallbladder. Doctor called, said, get it removed. So I went to several doctors. I said, why would my gallbladder not be functioning if I don't have a diseased gallbladder? And all 3 of them said, we don't know. We don't understand biliary dyskinesia. We don't understand why it quits working like that, and we can't guarantee you, if you have it removed, how much of your symptoms it's going to alleviate. So around that same time, my back was hurting really bad. It had been bothering me off and on for about 10 years. And I'm a therapist. I went to OT school. And when I got out of school, the first 10 to 12 years of practicing, I did orthopedics. So I had always been in a clinic, an orthopedic clinic with TOA at St. Thomas and stuff. And no offense, but we had always bad-mouthed chiropractic. And
I did too.
And so anyway, I had been seeing my friends off and on for my back, and it would help for a little while, and then it would go away. But as my gallbladder was crashing, my back was getting a lot worse, to the point I just thought, I can't take this anymore. So I kind of dressed in black and hid and creeped in the door there and got a consult. And basically what it showed was on that scan, in my thoracic spine, in about 3 levels, the black bars were just going all the way out to the side. Those of you who've had that scan done. And I said, yeah, that's exactly where I'm having a lot of pain. And then I said, can I see the innervation chart? And he said, why? And I said, well, this wouldn't happen to have anything to do with my gallbladder, would it? Because I didn't tell him about my gallbladder. I just said, I'm hurting. And he said, well, I'm not in the business of fixing gallbladders, but I can get the pressure off the nerve that goes to the gallbladder, and the rest is up to God. And I thought, well, I can totally respect that. So I came for my first visit. He did my adjustment, and it was this, I totally didn't expect this. I thought it'd take a few weeks to a few months. I literally, before I got off the table, I thought to myself, I've needed that for years, just that adjustment in my thoracic spine. And by the time I walked up to the front desk, I had a very distinct, it was icy hot feeling right where my gallbladder is. And I thought, well, that's weird. I'd had pain there before, but this was just a very distinct icy hot feeling, and then started having spasms in my gallbladder. Very strange, but anyway, I went on to eat 5 meals consecutively with 0 symptoms, and I had not had a meal without paying a price, so to speak, in months. So it just went on like that, and that was just a huge revelation to me, not just as a therapist, but just our overall health. I thought I had all the pieces to the puzzle. I was doing nutrition and detoxification. Yeah,
she was eating perfect. She was a picture of health in
doing everything.
The other essentials.
Yeah, I was doing everything, and so I realized I was missing a huge piece to the puzzle. And my only regret was I wish I had been doing this a long time ago. You know, I don't think my gallbladder would have come to that point had I know for a fact with that back pain and seeing my x-rays and the scans that I had pressure on that nerve for at least 10 years, but I didn't know that it was affecting one of my internal organs like that until it crashed. But that's just been a huge revelation to me, and I take my kids, both my boys, and they don't have any issues really with their spine, but I will always take them. My friends ask me, they say, I see why you're going, you have issues, but why would you take your boys? And so because I don't want them to have issues, and because I want their organs to not be stressed like mine were. I want them to function freely the way God designed them to. So.
Awesome, thank you. And I mean, literally, if we probably took give her a round of applause. Thank you, Lauren. And we could take the mic and kind of pass it around, and probably I could see 15 or 20 different faces in here that could probably give a similar story, but the best testimonials are the ones that don't ever have to give that story, that don't ever have to get there in the first place, and that's why we do check children. And it may seem odd to get a child checked by a chiropractor, but God made your kids just like He made us. The brain's supposed to control the body, and if there's any blockage, any interference to that, they can't express their health at their full potential. Gage, I know his hearing's better, and there's so many different things, but again, it's hopefully, if you're in that place, if there are things malfunctioning, then let's check you and let's find out as soon as possible if we can help. And if we can't help, we're going to get you in the right hands. We don't want you here if we can't help you. And then the better thing would be is everybody comes in with no pain and no symptoms. Everybody gets on the dietary plan. They keep their spine as healthy as they can keep it. And then we all end up on the cruise ship and not in that nursing home. So again, these little sheets, pass those in. The girls are going to be coming down the aisles right now. They're going to pass these sheets to the middle. And then we're going to take a break right now. The break is 15 minutes. How long is the break? 15 minutes. All right, we'll be right back.